Research has shown that a lot of the fear in children coming into the hospital or being diagnosed with a chronic or terminal illness is from the unknown. So a lot of what we do as child life specialists is we help them understand what's happening every step of the way. Child life specialists help kids through hospitalization, illness. We do a lot of medical educating, procedural support, distracting kids if they're having invasive procedures.
They are like our miracle workers. They develop creative ways to really work with these children and empower the children to take control over their diseases and illnesses.
We need them to do the work that they do. They can help establish a rapport with our patients. They can help explain things to our patients in ways that we sometimes can't.
My daughter Michelle was an oncology patient here. The child life specialist spent numerous hours with her. They were not just her child life specialist, they were all definitely her friend. I don't think my daughter could have done it without them.
We don't wear lab coats, we don't wear scrubs. To the kids, we're less threatening to them, and they tend to see us as the fun people.
When I was 16, I was diagnosed with a form of bone cancer in my left leg. No matter how I felt, like it could have been the worst week, the worst treatment ever, the second you see one of their faces, it's like never hard to smile.
And there's a whole change in the environment when child life specialists come into the room because they make it better.
The doctors fix the medical issue and we fix the emotional issues.
Child life specialists work together collaboratively. They're a cohesive team.
If I have a child here in the cancer center that has to be admitted to the hospital, the first thing I do when I hear that is I call my team over there and say, so-and-so's coming over for a couple of days. Can you leave something special in their room so that when they get over there, they feel welcome? Play is a child's most natural mode of expression. All week long, we have special visitors and entertainment to keep these kids focused on something fun and exciting as opposed to the pain.
We have tons of art projects all the time for the kids going on in the playroom.
We have a face painter that comes once a week.
Pet therapy that comes in. We have music. What we really use it for is for kids to normalize, to express themselves, also to socialize with other kids, because in the hospital, some kids can, feel like you're trapped in their room.
There's just so many things that they do to make the best of a bad situation and make something that's so not normal as they can.
We really try to celebrate life. You never know what a day can bring, so I think it's important to celebrate the milestones with these kids.
When a child is having a procedure, we can help with this in a few different ways. One of the ways is with procedural preparation.
We have a teaching doll that we use, and we use real medical equipment. It allows these children to gain mastery over the experiences that they go through. Here at Stony Brook Children's, we really try to include the whole family. We don't only work with the child that's sick, we work with the siblings, we work with the parents, sometimes the extended family when needed.
They realize, the specialists, that it affects the family as well and the other children, not just the child that's diagnosed.
They always included my brother in everything and made sure he got a toy or he got to take pictures too.
They help these children in difficult times, in times of uncertainty. They alleviate their fear, their anxiety, help lessen the pain.
It's hard getting any kind of diagnosis, so for a parent, you're trying to process so much, so they're definitely there for your emotional and mental well-being.
Even though I never wanted to come here, I always looked forward to something.
When we were in the cancer center, whether it was good news or bad news, or we were getting scan results or anything that was going on in our life, they were there with us, standing by our side, part of our family, part of our team.
I always say to people that it takes more than medicine to get well, and I really stand by that.
We believe that it takes play, it takes family, it takes being a child to help you.
Sometimes children just need that special thing in their world at that time to make them fight a little bit harder.